So welcome everyone, and thank you for joining us today for Osteoporosis Canada's webinar, Make Bone Health a Priority and Reduce Your Risk of Osteoporosis. And this is in partnership with the Collins Stevens Family Foundation. Before we begin today's webinar, Osteoporosis Canada acknowledges the land that our offices, located in Toronto, are on the traditional territory of many nations, including the Mississaugas of the Credit, Anishinaabe, the Chippewa, Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. My name is Cathy Pearcy, and I am the Community Engagement Coordinator with Osteoporosis Canada, and I will be your moderator today. This webinar will be hosted in partnership with the Collins Stevens Family Foundation. This presentation will provide general information about bone health and osteoporosis, and it is not intended as individualized health advice. If you have questions about your bone health or osteoporosis, please consult a physician. If you have questions during the webinar, you can enter them by clicking the Q&A button at the bottom of your screen, and we will do our best to answer as many questions during the webinar in the time allotted. I would like to introduce our panelists today who will be speaking with us. So Shelly Hagen is a registered dietitian and currently works as an educator in the Women's Wellness Program of the Grey Nuns Community Hospital in Edmonton. She facilitates menopause and osteoporosis education sessions and working one-on-one with patients to make them well-informed health decisions concerning menopause and osteoporosis management. Shelly completed her Bachelor of Science in Foods and Nutrition at the University of Saskatchewan, and she has a certified menopause practitioner, so a NAMS, through the North American Menopause Society. Also joining us today is Dr. Nota Klentrou, and she is an internationally recognized exercise and sports physiologist. Her research program uses applied and basic science approaches to study human performance and the implications of sport training, primarily with children and youth. And in the last 5 years, she has focused on sexual maturation, inflammation, adiposity, exercise, and nutrition, and how that affects musculoskeletal growth and development. In particular, this research is trying to identify the cellular mechanisms that explain how exercise training and dietary choices during childhood and adolescence affect skeletal development and lifelong bone health. And Dr. Teri Charrois is joining us as well. And Teri graduated with a pharmaceutical diploma degree from the University of Alberta, and she's worked at the Grey Nuns Hospital in the internal medicine for several years before completing her master's degree in clinical epidemiology. Teri then worked as a research associate with the Faculty of Medicine, coordinating research study and pharmacy practice. She came back to Edmonton in 2014, and she started her current position as a clinical association professor and director of practice innovation at the Faculty of Pharmacy and Pharmaceutical Science at the University of Alberta. She's also working on her Doctor of her Doctor of Education at the University of Calgary. And for her clinical practice, Teri works in the multidisciplinary osteoporosis clinic once a week in the Division of Rheumatology at the University of Alberta. So all three of our panelists today are members of Osteoporosis Canada's Scientific Advisory Council. So I'd like to welcome them, and Shelly, I will pass it on to you.
Thank you, and I'll just share my screen here. Good. So thank you for that introduction and the opportunity to be here to talk about one of my favorite subjects, and that's looking at nutrition and bone health. And, when we think about the skeleton, it really is a magnificent structure that consists of 206 bones that allow us to, that provides all kind of support and allows us to move and jump and run. And the skeleton also provides a lot of protection for the internal organs and other soft tissues. And then inside the skeleton, it is a real powerhouse of activity and plays a key role in regulating many critical functions. And so what I want to focus on in the brief time I have with you is looking at how nutrition impacts the integrity of the skeleton. And we're going to focus on calcium, vitamin D, and protein. And so when we're thinking about calcium, most people are aware that 99% of the calcium in our body is stored in our skeleton, in our bones and our teeth. But what many people forget about is that there is some calcium that is found in every living cell in your body and also in the fluid outside each cell. And that calcium in those tiny bits and pieces of calcium at the cellular level regulates some really, really important functions, such as the way your blood clots, and hopefully it clots normally, the way your body sends and relays nerve impulses. Calcium is also involved in keeping the pH levels of the blood very tightly regulated. And if there's even a small change there, the body can get into trouble very quickly. And calcium is also involved in functions connected with the way the muscles relax and contract. So it's a very, very tightly regulated because these are very, very important processes. So the body has some mechanisms in place to make sure that you are meeting your calcium requirements on a regular basis, because it doesn't want any of those really critical processes to be affected. And so how it does that, how the body always ensures that it has adequate amounts of calcium available is if you meet your daily calcium requirements. So if you get enough calcium coming into your body, then everything's in status quo, everything works good. But if you don't meet your daily calcium requirement, then the body's backup mechanism is to trigger the release of calcium from the skeleton. And yes, you do have a lot of calcium in your skeleton, but imagine if you are taking out 400 to 500 milligrams every day over the course of years, then the bone reservoir of calcium gets very depleted and the bones become very thin, which can increase your risk for osteoporosis and related fractures. So we want a plan in place to make sure that you are always meeting your daily calcium requirements. So let's start by sort of getting a sense of how much calcium is recommended. And as you can see on the screen, the number varies depending on your age group. During the adolescent time, we need a bit more calcium. And then for adults between 19 to 49, it kind of plateaus a little bit, but then calcium requirements do go up as we get a bit older, to the point of sort of needing 1,200 milligrams a day for both men and women over age 50. And so why do calcium requirements sort of change over time? Well, there's a couple of important factors. One, we need more calcium when we're younger, when those bones are growing. So in order to get those bones as long and strong as possible, so we can achieve what we call our peak bone mass, we need more calcium on board to get embedded into that skeleton. And so our window of opportunity for building that peak bone mass is up to about age 16 for girls and about 18 for boys. So that's why our calcium requirements are higher when we're younger. You can see from this graph that our bones kind of are in balance. We don't really gain, we don't really lose bone between sort of ages 19 and the onset of menopause. So calcium requirements sort of balance out at about 1,000 milligrams a day. But then some changes take place, especially for women, right around the time of the last menstrual period. And in particular, estrogen levels drop, which does trigger increased rates of bone resorption. But estrogen is an important hormone from a calcium point of view. Estrogen helps with calcium absorption. And when you have more estrogen on board, it also helps the kidneys conserve more calcium. So it makes sense then that when that hormone, estrogen hormone drops, that's why we are recommending a little bit more calcium, because you don't absorb it as efficiently as you get older. So are we getting enough calcium? And the answer, unfortunately, is a resounding no. So there was a recent survey of the dietary habits of Canadians. The information was collected in 2015, but published recently. And it shows that the median daily calcium intake for adults, for women between age 30 plus, is about 600 to 700 milligrams a day. And for men, about 700 to 800 milligrams a day. So even for the group of people that are between the ages of 19 to 49, where we only need 1,000 milligrams a day, we are not meeting our basic requirements. And this is even more of an issue in individuals who struggle with lactose intolerance, meaning that they have difficulty digesting the natural milk, the natural sugar that's found in some milk products. And unfortunately, I don't have a lot of time to sort of give you some strategies for dealing with that, but your local registered dietitian can be a good source of information to help you out. Vegans, especially people who avoid, or vegans who avoid all animal-based products, it can be more challenging to meet your calcium requirements. It's not impossible, but it just takes a lot more careful planning. And then individuals who just overall eating habits are not optimized are often at risk of low calcium, because often the first nutrient or the group of foods that goes from our diet, especially if we aren't paying careful attention, is we get rid of the dairy products or the alternatives, and therefore down goes the calcium intake. So let's think about where you get calcium, and there's really three sources. So one is food, so we'll look at the food sources, and in particularly the calcium provided by dairy foods. Another source is what we call calcium fortified foods. So these are foods that aren't naturally abundant in calcium, but manufacturers add it. So it's kind of like adding a calcium supplement to certain foods, and then that provides extra calcium in the diet. So the two main sources of calcium fortified foods in Canada are certain brands of orange juice, and the other source that is increasingly popular is a wide variety of non-dairy beverages that are now available in our grocery stores. And we prefer that if you meet your calcium, that you try to meet your calcium needs with food or calcium fortified foods. And if that just isn't possible, then another option is supplements, but they are a bit more tricky. And if you just take a supplement, you may only be getting calcium, whereas in food, you get a whole package of other nutrients that it can assist the bones in other ways. So there's lots of lists out there that you can find that list the calcium content of various foods. It just so happens that dairy seems to be a very easy way to meet your calcium requirements, because it gives you a lot of calcium with relatively small volumes of food. So if we look at the list, any type of milk product, a serving size of about 250 mils or 8 ounces gives you about 300 milligrams of calcium. Cheese, and most people enjoy cheese, is a great calcium source, but you do have to be aware of your portion size. So 50 grams of cheese, which is sort of the size of a piece of cheese equivalent to the size of 2 9-volt batteries, would give you about 300 milligrams of calcium. Whereas if you choose a Baby Bell or maybe a portion of Laughing Cow, that only gives you about 100 milligrams of calcium per serving. So you do have to be aware of your portion size. Yogurt is a great calcium source. So 3/4 of a cup of yogurt gives you about 250 milligrams of calcium. In the market nowadays is the smaller portions. There are 100 grams of yogurt if you buy like a single serve portion, and those give you about 100 milligrams of calcium per serving. So you have to know your portion size. There's other things like tofu, if it's made with calcium. Kefir is a popular drink. Nutrition meal replacements like Boost or Ensure as well can give you calcium. And I skipped over the skim milk powder. That's a great calcium source. And for instance, in my family, I have a 16-year-old who's not a big fan of milk. And so what I've got into the habit of doing is if I'm mixing up a meatloaf or muffins or other foods, I'll just throw some skim milk powder into it, and then I'm adding a bit of calcium and protein, and no one really knows it's there but me, so you can sneak it in. In terms of the non-dairy calcium sources, almost every food has a smidgen of calcium, but often it's not enough to really be totally significant. But if we look at some of the options out there, I mentioned about this whole plethora of milk alternatives that have hit the marketplace. So there's beverages made from soy, almond, cashew, rice, and oat, and most of the manufacturers are fortifying them. So they're adding calcium and vitamin D, and if so, then it would be equivalent to a glass of cow's milk. The fortified orange juice gives you approximately 300 milligrams of calcium per 250 ml portion. But again, not all brands of orange juice are fortified, so you have to read your labels carefully. You can get calcium from beans and chickpeas and other legumes, but again, recognize the portion. So 3/4 of a cup of cooked chickpeas or beans gives you about 100 milligrams of calcium. And salmon and sardines and mackerel and things like that are also good sources of calcium, provided that you're eating the bones. If you pick out the bones or throw them in the garbage, then that's not a calcium source. It's still a healthy food, but we just don't count it as a calcium source. So people often say to me in the clinic, well, I eat a lot of broccoli, or I eat this or that, I think I'm getting enough calcium. And yes, as I mentioned earlier, those foods do contain calcium, but we often do need fairly significant quantities of them to get meaningful amounts of calcium. So for instance, 4.5 cups of cooked broccoli equals the same amount of calcium as 1 glass of milk. And you may have 4.5 cups of broccoli once a day, but you're probably not going to do that 2 to 3 times a day. So the reality, the chances that you'll meet your total calcium requirements totally relying on these foods it's an extraordinary effort and really hard to sustain day in, day out. And remember, your body needs the 1,200 milligrams of calcium on a daily basis. So all these foods count, but it's hard to bring the total up very quickly with these foods in the portions that we generally eat. And so again, it's always best to try to get the calcium from food wherever possible. So if you can sort of get into the habit of thinking of including 1 calcium-rich food at each major meal throughout the day, so that's 3 times a day if you have a calcium-rich food, then you're generally going to be able to meet your calcium requirements with your food choices. And there's lots of other strategies that are available. Popular these days is steamed milk, or heating up the non-dairy beverages and then putting some of your favorite flavoring in it, like maybe a bit of almond flavoring or hazelnut, and it's nice and flavorful. Things like lattes, cafe au lait, chai that are made with milk or non-dairy beverages are great ways of sneaking in the calcium. Smoothies are usually hugely popular, and those are often made with yogurt and can be fortified with skim milk powder. And then there's your meal and replacements like Boost or Ensure or Carnation instant breakfast as well. So good ways of sneaking in the calcium. So when it comes to thinking about the calcium, are you getting enough? We always want to start by getting a sense of how much calcium are you getting on average from the foods that you eat. And then we compare that to, are you currently taking any supplements? And together, that number should equal 1,200 milligrams a day if you're going over 50. In the clinic in the osteoporosis clinic where I work, I spend more time getting people to think about cutting back on their supplements because they haven't taken into account sort of how much calcium they are getting from their diet. So there are some good tools to get you thinking about how you can figure out how much calcium you're getting from your diet. So Osteoporosis Canada has a great tool called the calcium calculator, and you just plug in some information and sort of give them a sense of the foods that you eat on a regular basis, and it'll help you calculate how much calcium you get from your diet on a regular basis. There's also lots of information on the labels of your products. So look at the nutrition facts table. So look at the portion that they're talking about and then zero in on the calcium. It's listed as the % daily value. And people always ask me, well, how do I turn that percent daily value? How do I think about that in terms of milligrams of calcium? Because you're telling me to get 1200 milligrams, but this is a percent. And so there is a little easy trick that you can do to translate that percent into milligrams. And basically all you do is add a 0 behind that number. So in this case, if I had 3/4 of a cup of yogurt, it would give me 25% of the daily volume of calcium that I need, or 250 milligrams. And so then you can use that to check your labels. If you're really struggling and you just can't meet all the calcium that you need, there are supplements to choose from, and there's lots of them on the market. But again, what you want to zero on is the milligrams of elemental or usable calcium is what you're looking at. So just two more points and then I will wrap up. So I want to also mention about the vitamin D, because it's really critical to have adequate vitamin D on board to absorb all that great calcium you're putting into your body. And vitamin D increases calcium absorption by as much as 1/3. And so the vitamin D recommendations are on the screen in front of you. So Osteoporosis Canada recommends that adults up to age 50 get 400 to 1,000 international units. And once we hit that age 50 threshold, it increases up to 2,000 international units per day. And in reality, most of us have to rely on a supplement to meet our vitamin D requirements. You do get vitamin D from the sun, but there's a lot of buts. So for instance, the winter sun in this part of the world doesn't activate the vitamin D in our skin. And in the summer, we're often wearing sunscreen, which blocks it. So that makes sunshine a bit unreliable. You can get it from food, but it's a pretty short list of foods that contain vitamin D. If you tend to eat fish 2 or 3 times a week, you're often getting adequate vitamin D, but for the rest of us, it's a real challenge. So the bottom line is most of us need to consider a vitamin D supplement and to take it year round. And so just read your products labelly, or read your labels carefully and get the amounts that are needed. Vitamin D is fat soluble, so it is possible to get too much. And that's usually in the form of supplements that are sort of overdone. Last but not least, we do want to make sure that you get adequate protein on board to help build and repair strong bones. And so the skeleton, 50% of the tissue of the makeup of the skeleton is protein. And so there's more and more evidence to look at the role of protein in bone health. And it just so happens that dairy foods are also a great source of protein. So it's sort of like killing 2 birds with 1 stone. And the general rule of thumb when it comes to protein is try to include at least 1 protein-rich food at each major meal, or if you're counting numbers, and trying to have about 20 to 25 grams of protein per meal. And there is some evidence that older adults may need more protein than we originally thought. So we may see the guidelines sort of change a little bit over time, but just a little bit of awareness about adequate protein is really, really important. So I'm going to turn things over now to Teri, who's going to talk about the role of the pharmacist in supporting bone health and a little bit about osteoporosis medications.
Hi, everyone. I'm just going to share my screen here for 1 minute. Hopefully everybody can see that well. Hi, I'm Teri and I'm a pharmacist, and I'm going to go through a few things about what your pharmacist can do for you. And that's primarily focusing on your community pharmacist, so where you go to get your prescriptions filled, but I'll also talk about other things pharmacists can do to help you managing your osteoporosis. So it's really important to know that pharmacists don't just count pills. So a lot of people think that they just see the pharmacist there behind the counter and they're counting pills and they're sticking things on labels, but we do a lot more than just that. So I just want to go through all of the other things we can do to help you manage your osteoporosis and just your medications in general. And pharmacists are considered the most accessible healthcare professional. You generally don't have to make an appointment to see us. So use that accessibility to your advantage and getting your pharmacist to help you manage your health. So what can your pharmacist help you with? So they can do many different things. So one of the first things they can do is help you manage your medications. So that means helping you to make sure you're actually taking the medications appropriately. And we'll talk about that a bit more in a minute, because bisphosphonates are quite difficult with regards to when we need to take them and separating them from other things. They can help you in managing any drug interactions that might come up, how to help you remember to take your medication. So not just, providing you necessarily with a dosette or something like that can help manage your medications, but also give you some apps that you can download on your phone that can help, etc. And also, if you are having some side effects with your medications, they can give you recommendations in terms of how to manage those. Excuse me. Yeah, another thing pharmacists can do, and all pharmacists across the country can do this, and most provinces actually allow this service to be, that pharmacists can get billed through the government for this service. But it's something called medication review. And so what the pharmacist can do is they can actually sit down with you and go through your whole list of medications. And that may help you in identifying if you're on any medications that put you at risk of osteoporosis or bone loss, medications that might put you at risk of fracture. It can also help you in managing your medications to make sure that everything is spaced apart and appropriately. And then building off of what Shelly talked about in terms of calcium and vitamin D, they can help you make appropriate choices for which calcium supplement you should take, and also vitamin D in terms of what supplement you might want to take and how much to fit in your daily life. So how can your pharmacist help with you? So what I do in my clinic isn't necessarily what all pharmacists can do, but a lot of this is easily done, whether it's in a clinic like I'm in or with your community pharmacist. So they can actually help you assess your risk of future fractures. So they can go through all your risk factors and help you identify which of those can be changed. And then sometimes there's risk factors we can't change. So we can't change our genetics, but we can change other things that may put us at risk of fractures, such as our smoking and how much alcohol we're taking in. So those are other things that they can assess for as well. Some pharmacists across the country can actually prescribe medications for bone health. I can in my province, I'm in Alberta, but it depends on the place. But most places, they can actually renew your prescription. So if you're not able to get in to see your family doctor or whoever prescribed your osteoporosis medication or your medication for bone health, they can potentially give you a little bit extra to get you through until when your next appointment is. Like I mentioned in the previous slide, they can do a medication review to help you identify high-risk medications, either ones that can worsen your bone health. Some medications affect how much calcium we can absorb, and they can work around that. And also to help you assess if you're on any medications that increase your fracture risk. So sleeping pills or some medications for anxiety can actually put you at increased risk of falls, and they can help go through that and help you manage those. They can help assess your calcium and vitamin D intake. Obviously, ideally, it would be great for you to see a dietitian, because the way Shelly would ask these questions and help you manage your calcium and vitamin D would be far more in depth. However, your pharmacist can do a quick calculation and help you through in terms of deciding what you may need with supplements. They can, in some provinces, administer medications subcutaneously, and a few of the newer agents we use for osteoporosis are given subcutaneously. So if you're not comfortable with giving yourself a medication, they can do that for you. They can help with monitoring of medications to see if they're working for you, and also helping you to monitor for side effects. So making sure you're aware of those things you need to be careful of or watch for while on a medication for your bone health. So in terms of helping you manage taking your medications appropriately, bisphosphonates are the most difficult bone health medication in terms of managing that. So most of you who are on that, hopefully you know that you need to separate your oral, so any pill form of a bisphosphonate, so those we think generally something like a lendronate, that you have to separate that from food and other medications. So your pharmacist can help decide when it's the best time for you to take that medication, because if it interacts with those other medications you're on, we want to separate it appropriately. We also don't not necessarily want you to take them at bedtime, specifically these bisphosphonates, because if you lie down after taking them, it can be really hard in your esophagus. And then with denosumab, one of the things that we want as pharmacists to make sure is that you're not missing a dose or delaying a dose too long. So we know if you delay doses of denosumab, this is known as Prolia, that it can actually have a worsening of fractures in your spine or vertebral fractures. So we want to make sure that we're helping you remember to get that dose on time. And if you need a reminder for that, or if you need to get a refill, doing that in advance of when your dose is due. And they can also help you to appropriately administer a dose such as Prolia in terms of a subcutaneous dose, or they can do that for you. They could potentially administer the dose for you if you can't take it yourself. Newer drug, romosozumab, which we only have a few people on in our clinic. It's known as Evenity. So again, it's important not to miss a dose. It's given once a month. And the pharmacist can help you decide if you're comfortable administering it yourself, or if you need somebody else, so another family member, or again, the pharmacist. And then the other medication we use a lot of is something called teriparatide. It's given subcutaneously every day. So it's really important for people to learn how to administer that themselves. The drug company that makes teriparatide actually offers some support, some nursing support with that, and your pharmacist can help you learn that as well. And then drug interactions. This is a big thing that pharmacists help manage. And the group of drugs that we worry most about are bisphosphonates. And that's because they interact with so many things. So we want you to take more calcium in your diet, but we don't want you to take your bisphosphonate at the same time you're having your cereal with milk or your yogurt in the morning. So working with your pharmacist to find the best time. We usually say 30 minutes before anything else with a bisphosphonate. So if you're on risedronate or alendronate, we want you to take that as far spaced apart from any calcium products as possible, ideally 30 minutes and longer if you can. Injectable medications don't actually have a lot of drug interactions. Some of that is because they're given by injection, and with the oral meds, they actually can combine physically with other things like calcium in your stomach. The injectable medications don't have that problem. We can see drug interactions if you're on a lot of medications and any other medications that are that can potentially lower your immune reaction to things, although that's not really been seen much in practice. So we don't worry about it too much, but it's more an awareness factor. So how do you remember to take your medications? We find that with these oral medications we use for bone health that are only given once a week, it's often really hard for patients to remember that day. So something you take every day becomes a habit, but if you're only taking something once a week, it's not so habitual. So how do you remember to take that? And how do you remember to take that, let's say if you're taking on a Sunday morning, to make sure then you space everything else in terms of your medications and food and calcium? You can talk to your pharmacist about setting up a callback for you. So using your pharmacist for you to help remember that your Prolia comes every 6 months. And also if you're a snowbird and you fly down south, how to manage that in and around your doses of Prolia is really hard and something I help my patients manage. And they can also potentially help you find an app or another way for you to remember that your dose is due. So that's really useful, I find, especially with these medications that aren't given every day. In terms of managing side effects, we find that most osteoporosis medications are generally well tolerated, but what happens if you do have a side effect? And that's when you should really phone your pharmacist as first call, and then they can advise you on how to manage it yourself, or if you need to see a physician or whoever prescribed your bone health medication. The usual ones we see with bisphosphonates are stomach upset, and that's often because we have to take them on an upset stomach. There is a newer medication that you can take with food. However, it's not covered by a lot of drug plans, but that's potentially an option. Or talking about, well, if this isn't working for you and you're getting a lot of stomach upset and vomiting, can I change to something else? Pharmacists can also help you in determining if you can take your medication at a different time. Like I said, those oral bisphosphonates it's so important that they're taken before other things, and they can help you find a window within your whole medication plan about what the best time is. Is there anything you can take to help with the side effect? This isn't our ideal choice of managing side effects, because then you're taking a drug and adding more drugs on to manage side effects, but there are some alternatives there. And you can also talk to your pharmacist about whether or not that side effect will go away. So for example, like I said, with bisphosphonates, often when we take them orally, they cause some stomach upset. That seems to go away after a week or two. So if you need some reassurance about whether or not it goes away, talk to your pharmacist. And you also need to be aware of the serious side effects of your medications and what you need to watch for. So most of these medications, we're worried about your oral health and what you need to tell your dentist. And so you can always confirm that with your pharmacist as well. So I mentioned about a pharmacist doing a medication review. So that's looking at all your medications and what can be moved around and how best to manage them. And so your personal pharmacist, not me, because I'm just here to provide you general information, but your personal pharmacist can help you review all your medications and help you manage them the best way possible. And if your pharmacist says they can't do that, I would recommend, is there another pharmacy where that service can be offered to you? So there's no way to tell. It's just you building a relationship with that pharmacist and then asking if they can do that for you. And another thing you can do in a medication review, it's not just about your osteoporosis medications, but also those medications that put you at increased risk of falls, which is very important. So what medications might make you drowsy or dizzy? If you lower your blood pressure too much, that can make you dizzy when you stand up and put you at risk of falls. So they can help you in managing all that as well. I'm only going to talk about this briefly, but more with effect to how calcium and vitamin D may be affected by other medications, because Shelly did such a great job talking about these elements. But calcium absorption can be affected by other medications, not just bisphosphonates, but other medications you take. And so it's important to know that the calcium isn't interacting with anything you're taking if you're taking an oral supplement. Your pharmacist can also help you determine which calcium product is best based on your whole medication list. So Shelly had listed a bunch of different calcium salts, and they can help you pick which one is best for you. And again, with vitamin D supplements, they can help you pick which one is best for you. Usually with vitamin D, it's less of a concern than calcium, but they can help you in managing that as well. So with that, I'm going to stop sharing my screen and I'm going to hand it over to Nota, who's going to talk about exercise and bone health.
Hi, everybody. Let me share my screen here. Okay. So let's talk about exercise, since it's the only one that's left out from Teri's presentation on medication. Exercise is a great strategy to keep our bones healthy, but it's not a medication per se. It is a strategy. And by the end of this presentation, I hope you would agree with me how exercise works and why is important, and a few tips on how to approach it. So bone is a living, a growing tissue. It's hardened by minerals, especially calcium, and of course, protein also adds flexibility to the bone. Bone is made of cortical bone, which is the dense, compact outer layer, and trabecular bone, which is the inner structure, and it looks like a sponge. So you can see it here in the epiphysis. The two ends of the bone have mostly trabecular bone. Bones support and allow us to move, as Shelly said, and bones also store vital minerals, mainly calcium. Bone is very dynamic, is metabolically active, and it undergoes growth, which means growing in dimensions, and modeling, which is adding more mass, more bone mass, and that happens usually during childhood and adolescence. But then as we grow older, bone still continues to remodel by two processes, namely bone formation, which is regenerating new bone, and bone resorption, which is removing old bone. And that happens because of the cells, the bone cells involved in this process of bone remodeling. Osteoclasts are the cells that remove bone, and they create a cavity on the bone surface. And then the osteoblasts, which are the bone formation cells, they come in and they start filling this gap with new collagen and new minerals. So the repair or the remodeling process is complete. So bone does this continuously to regenerate itself. But the activity of osteoblasts and osteoclasts varies throughout the life cycle. So during youth, formation is more than resorption. So more bone is formed than removed because bone is growing in dimensions and adds more mass, and at the same time regenerates the old bone mass. And that happens during youth. During adulthood, these two processes are balanced. They're coupled, and therefore, as much bone that's removed, the same amount of bone regenerates. But as we grow older, resorption cannot be matched by formation. And this is when we see bone loss. And of course, if bone loss continues, we can see more spaces in the trabecular bone in particular, which we call osteoporosis or low bone mass. So during aging, we start losing bone at a rate of about 1% per year in mid-80s. And at menopause, bone loss increases. Of course, in men, bone loss is slower, and it doesn't happen until after age 65. And of course, if bone loss reaches a point where fracture risk increases, this is what concerns us the most. And as you see here, with age, bone mass, because formation is more than resorption, increases. It reaches what we call peak bone mass, and then we start to lose. And of course, men reach higher peak bone mass, and therefore they lose at a slower rate, and they don't soon get into this increased risk area. But even women can delay getting to that risk area if we put more bone during the adolescence, and therefore increase our peak bone mass. So the optimal timing to increase bone mass is actually around adolescence. And we can do that by, of course, nutrition. Of course, there are some genetic predisposition there, but physical activity seems to be a very good strategy to increase bone mass and develop more peak bone mass, so that we put more bone into our bank, and we don't get, as we lose, we don't get to that increased risk area too soon. So how do we do that? Well, we know the Mechanostat theory, which actually states that bone responds to the amount of stress that's placed on it. It's like an elastic. More stress you put on, more bone is going to remodel. So when more stress is placed on all the bones, upon the skeleton in general, bone is gained. And if not enough stress is placed on the skeleton, then bone density and bone mass is lost. And that can happen during bed rest, prolonged bed rest, because we don't add stress on our bones, either by muscle force or by gravitational force, and therefore we lose mass. And the same happens, we know that space, it's a problem, and that's why a manned mission to space is delayed, because we must solve first this issue with bone loss. So exercise is a lifelong therapy. And it's because during childhood and adolescence and youth, we can actually use exercise to place stress on the bone and increase bone acquisition, and therefore reach higher peak bone mass. And that is a very good prevention strategy for later in life. And during aging, we can reduce bone loss by continuously placing stress on our bones, and therefore manage either osteoporosis or even manage bone loss and not get into the osteoporosis. So how do we do that? First of all, we need to recognize that exercise actually sometimes is not coming to us very easily. It's something that we rather avoid. And as we grow older, we rather avoid more. So let's focus on what kind of exercise should we keep in mind when we talk about bone. Well, first of all, we need to bear weight, because this way our spine and our legs, so the big muscles of our bones, of our skeleton are stressed. And which activities, of course, we add impact and weight on our skeleton is walking, hiking, jogging, climbing stairs is a very good way to stress our bones. And of course, if we add more impact, like during jumping, of course, especially during adolescence and childhood, is a very good way to actually put a lot of stress on our bones, but is not ideal for people who have had a spine fracture or at a higher risk of fracture. So we need to go back to weight bearing in these cases, which is simple walking. It actually works beautifully. Resistance, because our upper bones need, upper body needs also to be stressed. We can use free weights, we can use machines, whatever actually feels right to us. And try to keep it random. Do not repeat movements every day, because repetitive movements build bone less, and of course it's also boring. So variety, it's a good way to load our bones and also keep ourselves going back to the exercise. So try to exercise briefly and often to keep our continuous stress on the bones, and also make ourselves more inclined to exercise, because if we go for long workouts, actually after a while, research has shown that people do not adhere to long exercise sessions. And don't forget that exercise will also strengthen our muscles, because they're very important, and they also put stress on our bones when they move, as they pull them, okay? And there is age-related loss of muscle as there is age-related loss of bone. And when we lose muscle with age, there is reduced strength. And of course, it contributes to mobility issues and often disability, and we need to resist that. So exercise is a great way to build and maintain muscle mass. It is important to also place stresses on the bones. It helps maintain balance, and balance exercises, therefore, are very important. And of course, it is important at every age because muscles are important at every age. And it also, as we build more muscle mass and more muscle strength, we prevent falls. And that's where the problem is with osteoporosis. It's not only the condition itself, is because when we fall, we break bones easily. So even if we are at the osteoporosis stage, we can still build some muscle mass, so we reduce the risk of falling, and therefore we reduce the risk of fractures. So, so how we can do this? How we do some balance exercises? First of all, we need to examine the risk factors and develop appropriate intervention. So we know for each one of us what is the most appropriate exercise. But we also, because we're talking about balance and falls prevention, we also need to assess our home situation and identify any hazards and modify so that we reduce the risk of falling. And of course, we must strengthen our muscles and include some balance exercises to help with falls prevention. And if like more social type of exercise, although now with COVID, it did become a little more unsustainable, but it will come back, and some of us enjoy exercising with others. Tai Chi group exercise, there's been a lot of intervention showing that it is a very good way to improve our balance. And of course, we can strengthen the upper body muscles, the shoulder muscles, by pulling and adding weight and load as long as possible, and hold it. And when we hold this pulling exercise as we strengthen our muscle and we provide resistance, is what we call isometric. When we hold it, it's a static exercise, but it's very important to increase muscle mass. And of course, we have back strengthening or core training. We need to incorporate that because we need to increase the strength of our core so that we reduce the risk of falling. But we also need to avoid some movements, either when we exercise or we move around, because they're not good for people with osteoporosis. So if you are diagnosed with osteoporosis, exercise as the ones you see on the screen, you need to avoid. So we don't bend too low, we don't twist, and we don't try to lift and reach too high. And of course, we do not raise weight. So just keep in mind, even when we exercise, that these movements need to be avoided. So what does all that mean? So let's summarize and think about where we are in the presentation. So what did we discuss? Mechanical loading via exercise has greatest potential in growing skeleton. So during childhood and adolescence, we add exercise, we add impact exercise like jumping, because we need to stress the bones, and because the skeleton is young, we can actually load it the most. And exercise can improve bone mass development, therefore, in children, but can also prevent bone loss in adults. Of course, exercise is different when we get to older age, but it needs to be sustained and be done regularly. And of course, there are other benefits of exercise that can indirectly affect fracture risk, as we talked about muscle mass and muscle strength and preventing falls. So we need to start young because the exercise has greatest effect during growth. We select exercises of higher impact, as much as high as we can, that stress the bone more. Exercise briefly, but often, as we talked about it, it's very boring to repeat the same exercises, and it's very boring to have long workouts. So it's better to have shorter workouts, yet often. And continue exercises as you age. There is no appropriate age for exercise. There are exercises appropriate for your age, but exercise is good for all ages because it maintains and improves muscle mass, improves balance, and it reduces the risk of falls. Thank you very much and for your attention. I hope I convince you that exercise is a great strategy and it can be fun and it can be sustained for life. I'll pass it to Cathy from Osteoporosis Canada to handle the questions.
Wonderful. Thank you, everyone. That was wonderful presentations by all three of you. I just want to be very mindful of the time. So I'm going to ask, we've had a number of questions come in, but I'm going to ask each of you one question, as I said, just to be mindful of time. So Teri, I'd like to start with you. And the question came in, can bone density loss be reversed?
Thanks, Cathy. So that's a question we get asked about a lot. And our goal isn't always to reverse, our goal is to maintain. And that's usually our best strategy. There are some, there's one medication, possibly two, although we need more data. There is one medication that actually can build bone, and we see increases, like significant improvements in their bone mineral densities for people who are on teriparatide. Teriparatide can only be used for 2 years and is, at least in Alberta, about $20,000 a year, and something that you have to meet certain eligibility criteria, have to have very, very severe osteoporosis to even meet the criteria to be considered. So generally our goal is maintenance of our current bone density with medications.
Wonderful, thank you. Shelly, a question came in, is there a difference between calcium absorption from vegetables compared to dairy?
There is a bit of difference. Dairy foods, the calcium that's in, the type of calcium that's in dairy rich foods is highly absorbable. And there is calcium in other foods that I mentioned, legumes and spinach and things like that. But unfortunately, the body isn't able to extract it quite as easily. So it's not quite as available. But again, those foods are very healthy. So I don't want people to eliminate them, but we just don't put as much weight on them as a calcium source.
Wonderful, thank you. And Nota, you definitely showed us why we need to exercise, and I liked your comment of, exercise often. So a question came in, as exercise is important to bone health, should we push through even if we are feeling pain?
No, actually, we should respect what our body tells us. So we don't overcome pain during exercise. And I'm talking about pain, bone pain. And I think we can feel the difference. Like after an exercise workout, the muscles are short, okay? And we all feel like, we can move very well after exercise because we feel a little bit of muscle pain, and that's normal and it goes away. And that's not dangerous, it's normal inflammation, which actually is healthy, not unhealthy. But if we feel long-term like chronic pain in the joints, we need to be careful. We need to talk to professionals. We shouldn't do it on our own. So refer to your physical therapist or the kinesiologist and talk about your pain, where it's coming from, and try to be mindful of it.
Wonderful. All right, I'm just going to finish up here. So thank you so much for all of our speakers today. Shelly, Teri, Nota, I think you've given everybody lots to think about and lots to take away today. So some tools, after you've heard this, some tools and resources that can help manage your bone health. So visit our website, osteoporosis.ca. We also have an Unbreakable the OC podcast, which has some wonderful information on it. And you can listen to those on our website or stream them from your favorite podcast provider. Check out the Know Your Risk. That's a really great tool. And this webinar will also be recorded and other webinars, past webinars that we've had. So this one will be available within the next 24 to 48 hours. It will be up on our replay page. Again, I would so like to thank our partners here with Collins Stevens Family Foundation for helping make webinars like this possible through your partnership. So thank you so much. And to everyone watching, to be sure to stay connected by subscribing to the national e-newsletter. So you can see at the top of the homepage where the subscription or the subscribe button is. And that will notify you of upcoming webinars and other things that our organization is doing. You can also follow us on Facebook, Instagram, and Twitter. Until next time, thank you for joining us. Stay well and stay connected. Take care, everyone.